Good morning, ladies and gentlemen, and welcome all of you to WONTECH Symposium. Today we have three speakers who really qualified for the practice that they experience a lot of machine that they use to the first and the second section, we will talk about the Monopolar RF. That, as you know, there are a lot of machines in the market, and today we are present the dual mode radio frequency, and we have two doctors who explain that's why the Origio X from one tech company have distinguished the character. The first speaker of today is Dr. Dongdao Dongnam Sawang. She is board certified ophthalmologist, but she really in love with Monopolar RF. She will share the method that how can you maximize the result on safety with dual mode Monopolar RF. Please welcome her.
Good morning, everybody. In my topic is how maximize result and safety with dual mode monopolar RF. Dr. Dongdao Dongnam Sawang from StarMed Clinic. Thank you for your kind introduction. The optimal outcomes depends on the T pillar. The pillar one that is about the device. So you should know deep into the energy physics and then mechanism of action for the tissue that you want to target for. And in this topic, we deep down in the new dual mode for allow us to customize our treatment. In the second pillar is about summarize the aging process and focus on what is the specific tissue layering. And the last is the main, is the thing that's very important about the biological response for the treatment. And the last one is about the patient who is operate the device. So you should have the good treatment planning and have the technique mastery and can manipulate the energy to achieve the good outcome and safely. Let's deep into the radio frequency basis. Is this the formula that when you pass the current to the tissue, they have the impedance. So the energy is proportion to the current that we put inside and the impedance and the treatment time. In the table, they show that in various type of tissue, they have a difference of impedance and water contents. So after that, they will create the heat generation difference in any tissue. For example, the dermis and fibrous septum that have lower impedance and good conductivity and more water content. So that is a tissue that can generate more heat than fat and bone. That is why there's a term of dermal heating and preferential heating of fibrous tissue safety. That's why physics came to the biological. The factor that affect of the depth is the frequency, surface area of tissue type, as I mentioned before, and the last one is the tissue temperature. It's a graph show that with or without cooling, the depth, the effect of the heating is more deep in the cooling, with the cooling. Another term is leeward thermal gradient. It meant that when you pre-cool the tissue, and after that, you RF on with the cooling, you see that the gradient is more heater, deeper. It's a term of reverse thermal gradient. Let's to the second pillar. It's the pillar of the aging assessment. There are change in many layers. The first one is the damage. Because of the collagen depletion, it's lost elasticity. And the second one is the change in the subcutaneous tissue. There are weakening of the retinacular cutis and fiber safety. And the last one is about the fat compartment. There are change of the volume in this layer. So the importance that you see that they are communicated above to the deep to the bone by the ligament. There is a paper show the relationship between the retinacular cutis dent and sagging facial skin. They compare with the mild sagging and severe sagging. They found that the RC is denser in mild sagging than in the patient that have severe sagging. So it is a mechanism of skin sagging that they think that they are from the retinacular cutis. They found there are dense RC in no sagging, but there are more sparse RC in severe sagging. That's why we can target the layer that we want to treat with monopolar RF. That the second one, dermis and subcutaneous fat in the two layers. So we want to affect from the monopolar RF by want to improve the epidermal texture and want to thickening the dermis and remodeling and contract the dermis. Another tissue that I have told before about the fibroseptal network, we want to contract them and remodeling them. And the last one is the subcutaneous fat. So why the biological response is very important? Because mechanism of neocollagenesis, after we put the heat inside the tissue, there are the neocollagenesis. After that, 3 or 6 months later. So it's just very important to essential nutrient for this collagen synthesis. I recommend to have a supplement like vitamin C, amino acids, and the cofactor is zinc and copper. And we add more on the antioxidant to prevent degradation of the collagen. So the physiological support of remodeling is very important because the remodeling of the tissue, the collagenesis, take place when growth hormone surge during slow wave that enhance protein synthesis. So adequate sleep and nutrition will optimize post-treatment repair. Let's talk about the device. It's a 6.78 megahertz. The key feature is there is 400 powerful output. They have the two mode, dual G and X mode. So they can deep per layer and make the long-lasting heat. I will show you the heat diagram. Show that in the X mode, because of the strong cooling, the heat is deep down and lasts longer than in the G mode. So the G mode is treated for the superficial heating. The evidence from the depth is the evidence from the penetrated depth. When we put the high cooling, the depth of treatment is deeper. It's a diagram of the G mode and X mode. In the G mode, they have 5 sub-power and 5 cooling powers. But in X mode, there are 11 sub-cooling, 5 sub-power and 11 coolings. Treatment mechanism is when we put the current 6.78 megahertz, they can create the heat around the target temperature is 40 to 60 degrees in the tissue. And after that, they create a micro-inflammation phase of fibroblasts via heat shock protein. So there is introduction for the process of tissue repair and fibroblast activity. And the last one is will generate a new collagen and the skin condition improve. So the indication that we target the tissue, we want to treat to lifting and tightening, to skin rejuvenation, and to wrinkle reduction. So the ideal candidate is the person that they have not much sagging, they have a fatless skin, they have a eyebrow laxity, jowling, sagging tissue, and to improve skin quality like a pore size and cellulite. They can treat around periorbital and perioral. It is important to individual mapping by planning the treatment. The first one, you should think about the shot distribution by mapping the specific to the defect zone, and about the shot number to proper to the problem. Dividing based on the anatomical area. So the technical parameter that influence the outcome is the important things is about the energy endpoint. If we do under the target, it ineffective stimulation. So the target temperature, as I told you, is 40 to 60 degrees is the optimal response. But if over the target, maybe the risk of thermal injury. Another factor is very important about the shot distribution. It means that higher density shot will over the area of the greater laxity. The last one is the vector planning. So you should decide to energy delivery along the anatomical lift axis. It is my strategy for facial contouring mapping. I divided into 4 zones. The first one is the mid-face support. The second one to treat at the nasolabial area. The third one is around the lower face tightening, including jowling. And the zone C is submenton contouring and jawline. So the goal is to restore the facial structure, improve the tightening, and enhance the jawline definition. So the important thing is that we should reach the clinical endpoint. During the treatment, you should check all the time. The first is seeing, a visual tightening change by seeing. And the second is you see the myerythema. And you can palpate by your finger to touch, warm to touch, to test the temperature and see that there are palpable tighten change. And the last one is hearing the feedback of the patient by his sensation feedback. The target is the 3 that hot but tolerate. Another point is how to maximize the energy. There is the 2 options. The option 1 is you use the high power. And the option 2, you use the high volume. By adjust, if you have the limited shot, you can raise the intensity. But you unlimited shot, you can add the total shot count. In the high power, you should change the technique by moving technique. But in the high volume, you can treat with the conventional stem technique. Different technique. Moving technique can use the high intensity, make the uniform heat distribution, and increase the patient comfort because of it not stuck at the same place. Prevent the epidermal heat spike in one area. But stamp technique is you can use just only mild to moderate density, and you use a localized concentration at the same place. They can do vector specifically because of you have mapping before. The energy built up by cumulative. But that is the list of the fast moving technique. That's why, because burn and overheating is come from lower speed of moving when we move to the unsmoothed area, such as the forehead or at the prominent bone, like zygoma. And in the small area, example of the submental area, we can move easily, so it will stop, and the burn and overheating mostly happen in this area. Another risk is the inconsistent result, because when you are moving, you can't mapping, because there's no mapping. Maybe uneven energy distribution, the energy is accumulated in one area. The last one is about the discomfort and pain. Because of when we move, we press down to the skin, and the patient feel discomfort. I have preliminary study by use both techniques, speed phase. In the right side, I use fast moving technique with G mode. Total energy is the same, is 40 kilojoule. But in left side, I use the stamp technique. They use more shot than in right side. We use 4 and 45 shot. Level is moderate intensity, but compared with the right side, I use the highest level. And I also treat at the submental by moving technique of G mode. Total energy is 25 kilojoule. It is immediate after. I think that there's no significant difference between right side and left side. Let's show the quantifier analysis after 3 weeks. You found that it improved in right side. I think similar with the left side. The jawline definition is better, the sagging is better, and the patient is look slimmer. The submental is obvious diminished. Is the left side and right side. Compare the tissue lifting. I think it's not difference in the both side, and obviously lifting. The volume depletion is the same in both sides. The next case, after that, after the example, I use just only moving technique. We see that improvement after 4 weeks. The lifting tissue and the volume loss. The next case use high energy and more short count. Total energy is 132 kilojoule. After 4 weeks, we found that it more lifting effect and look slimmer and the sharper jawline. The lifting tissue is better. The volume loss is clearly seen. The next case, we use the same 930 shot with high energy with moving technique. It's improved. The lifting tissue is improved both sides. The volume loss, they look slim. And the last case, we use the same technique. After 1 month, so the maximum outcome safety maybe require a deep synchronize of the device, the patient, and the physician. Yes. Thank you.
Thank you, Dr. Dong Dao, for very insightful in radio frequency. We are known about the physics behind, and we know some techniques from Dr. Dong Dao that use very high energy and the total accumulate energy. And the next speaker will talk about another mode of the Origio X. They mainly use the X mode for the stronger cooling. And we have Dr. Anna or Dr. Shalini Piantanapak from Real Aesthetic Center. She not only the doctor, but she also the celebrities. As you see, she is very beautiful and she have a lot of experience in Monopolar RF, and she is also the Thailand trainer for Origio X2. Please welcome her.
Thank you for very kind introduction. And good morning, I'm Dr. Shalini Piantanapak, or you can call me Dr. Anna, an aesthetic doctor from Thailand. And today I will discuss about one of the most common concerns we see in our aesthetic practice, submental fullness and jawline laxity. I believe that many patients want visible improvement, but some do not ready for surgery or any prolonged downtime. So can we offer a treatment that effective, safe, and practical? And today, I would like to share my experience using Origio X in X mode in the submental area. Because double chin is not simply related to body weight. So in clinical practice, you can see some slim patient with significant fullness or with double chin, while other with a high BMI, you can see they have a good jawline. Because it's not only about the fat, but genetics, hormone, skin laxity, and posture. So multi-layer involved, every patient has the submental concern. And when we look at this area, several layers have changed: fat accumulation, skin laxity, muscle laxity, and bone support loss. So multi-layer are involved. Treating fat alone is not enough. And although we have several options to treat in this area, but each has limitation. Surgery may be very, very effective, but it's high risk and you need a prolonged recovery time. Injectable maybe give you good result, but you need multiple sessions, or maybe some can face with swelling, bruising, or variable fat reduction. And for cryolipolysis, it can target only the fat layer but not the skin. So is there anything that non-invasive, low risk, zero downtime, and can target both fat and skin? and it is a monopolar RF. Actually, in the submental area is a little bit challenging to treat because the skin is thin, the anatomy is complex and high contour sensitivity and highly visible and constant movement. So precise energy delivery is very, very essential. And that brings us to Oligio X. Oligio X is the monopolar RF that designed for control energy delivery. It has the real-time impedance check, real-time energy control, and good cooling system that help to protect the epidermis. And it has two modes, G and X mode. And it has continuous short mode that allow us to treat faster than any monopolar RF. And how monopolar RF remodel our skin? Actually, the mechanism itself is straightforward. The RF energy penetrates the skin and create the control heat in the dermis and then cause immediate collagen contraction and stimulate collagen production called neocollagenesis. And the result you will see is tightening, contouring, and skin firmness. In preclinical study, there is zero epidermal damage or energy level or time point and both G and X mode. But actually, safety alone is not enough. The next question is, does it work? The efficacy data are encouraging. Significant collagen stimulation was observed after treatment. And also, elastin level also increased, which ultimately contribute to improved contour and skin tightening. And this slide confirms that the collagen we are measuring is nearly synthesis, not just rearranged. And as we know that Oligio X has two modes, G and X mode, is quite different. G mode can provide superficial heating, so it can target in the skin layer. It causes skin tightening and skin quality improvement. And X mode can target the deeper tissue layer, so it can reduce fat more effectively. And this allows treatment to be tailored according to patient need. And who are the ideal candidates? Patients with mild to moderate skin laxity, patients to mild moderate submental laxity and early jowl formation, who has skin laxity after weight loss and who don't need any needle or any surgery or any downtime. The protocol we use is X mode, 100 to 300 shots. And before we review the case, I would like to mention that these photographs were taken at baseline and 1 month, but collagen remodeling continued beyond 1 month, so this is still early result. Let's start with case 1. This is a female patient with a slim profile, treated with 120 shots in X mode. From the frontal view, you can see a mild improvement in jawline definition. And the lateral view, the jawline appears modified with visible tightening of the submental area. And in the extend next position, you can see increase in skin tightness and upward lifting of the submental region, indicating improved firmness. And the arrow indicates upward lifting and tightening of the submental area, indicating improved skin firmness. And on 3D analysis, the blue area represents volume reduction, so you can see volume reduction in the submental area. And this video further confirms increased tightness at the follow-up. Moving on to case 2. This is a female patient with a high BMI. We treat with 220 shots in X mode. From the frontal view, we can see a reduction in submental fat and reduction in the double chin appearance. And the lateral view, we can see a reduction in the submental fat also. In the extend next position, a reduction in submental fat was observed. And the arrow demonstrates upward lifting and tightening of the submental area, indicating improved skin firmness. And the blue area represents volume reduction, so we can see the significant volume reduction in the submental area. And focus assessment of this video, we can see the submental area demonstrate a significant reduction in fat. And case 3 is another high BMI patient we treat with 200 shots in X mode. From the frontal view, the lower face appears more contoured with reduced submental fullness. In focus assessment, we can see a significant reduction in the double chin. And from lateral view, a reduction in submental fat with improved jawline definition is observed. And this video further confirms significant reduction in the submental fat. In case 4, we can see a reduction in submental fat also. In closer view, confirm a significant decrease in the submental fat. And this video confirms a clear tightening effect of the submental area. And finally, case 5 include a male patient. From the lateral view, we can see mild improvement in jawline. And a closer view shows a noticeable reduction in the fat. And this video, we can see a submental fullness reduction with improved jawline definition, overall facial harmony even in male patient. And across the case, a consistent pattern of improvement was observed, including better jawline definition, reduced submental fullness, and visible tightening. Importantly, these results were seen not only in patients with excess fat, but also in those with primary tissue laxity. And actually, Oligio-X can use as a standalone treatment. However, it also integrates with other modalities such as microfocus ultrasound, botulinum toxin, and dermal filler. So treatment selection should always be individualized. And another important point is patient expectation. Some tightening may be visible early, but actually the collagen remodeling takes time. So you can see the maximum result in 1 to 3 months. And before concluding, I would like to share a few practical pearls. Avoid excessive overlap and use lower energy in very thin skin. And always respect anatomical landmark. And remember that our goal is control remodeling, not aggressive treatment outcome. So recognize this clinical sign during the treatment. We can see mild erythema that occur during the treatment, but it will resolve quickly, and immediate tightening sensation that patient can report, and feeling firmer after the treatment. And patient must feel the uniform heat distribution, not focal hotspot, because our goal is control, not aggressive remodeling. And to conclude, I would like to leave you with 3 key messages. First, submental fullness is a multi-layer problem, so successful treatment requires more than the fat reduction alone, and Oligio-X offers a safe and practical option for improving both contouring and skin quality. Thank you so much.
In terms of the medical practice, we can adjust the parameter of the machine that maybe in some patient can tolerate more energy or more pain, because the pain sensation or the pain threshold is very individual. but you should ask your patient to grading the pain. And as Dr. Anna said that in maybe in some case that cannot tolerate only the small energy, and the consultation is very important rules in our practice, because if you already give the information to your patient that the result will come in 2 weeks, in 1 month, or you have to wait for more than 1 month to see the maximum result, is very very convenient, very important. For the next speaker, I have very insightful doctors from Indonesia. Dr. Almond Wibowo, he is the owner of the private clinic, and he is also the global KOL for WONTECH company. He experienced a lot of laser machine, and he will give the lecture about the 1927 nanometers thulium laser for the multifunctional laser from hair to toe. Please welcome.
Okay, good morning everyone, and thank you Dr. Santi for the introductions. And to be disclosure, this session is supported by the WONTECH, because I'm going to speak about the Lafiang, which is the thulium lasers. And I'm going to say thank you to WONTECH because they're providing me with such a nice lasers. Why? In my clinic, I do have a lot of devices. For example, I do have 3 picos. But the difficult thing is, if in one clinic I do have a lot of devices, it's quite hard for me to create another branches because I have to buy a lot of devices. So basically, there is 2 kind of devices lately available in the market. So one is a very specific devices that treated pigmentation, treated resurfacing, or treated for the hair removal, a very, very specific devices. Or second one is a multifunctional devices, which is thulium laser 1927 is one of it. Why? I'm going to say it's a multifunctional lasers. I'm going to explain it in details. But I do like, for example, like the long pulse Nd:YAG lasers, which is also the underrated lasers. Thulium lasers also is underrated laser. But if we know it by details, it can work for many things, and it gives us plenty of options. It gives us plenty of choices to treat our patient. So it's redefining how we use lasers lately. So basically, from head to toe, it can treat from the hairs, which is our scalps area. It can be treated for the pigmentations. It can be treated as a transepidermal drug delivery. It can be used as a depigmenting lasers as well. So I know it's not a very specific lasers that work for a very specific purpose, that's true, but it can work for many things. Why? Why 1927s? Because based on the penetration itself, it works on the basal membranes. Why? I have these lasers work on the chromophore water chromophores, just like the CO2, just like the erbium, just like the erbium glass or anything else. To be noted, I have CO2 lasers in my clinics. I also have the erbium YAG. I also have the erbium glass lasers as well in my clinics. So basically, I have 4 devices that works to destroy the waters in our cells. But why? Just lately, I use thulium the most compared to the CO2 and erbium because of the depth. The CO2, I'm going to start with the erbium first. Erbium is a very, very specific, very, very sensitive to the water. That's why erbium can only work on very superficial layers. It's good for the pigmentation, for the superficial layers. It's good for the resurfacing. It's good for the fractional, for the acne scars, but only for the superficial layers, because it cannot penetrate deeper than the basal membranes. except you are using a very high fluence, very high power, and do multiple pass or multiple repetitions. But if you are using a very high energy, you know, in our Asian skin type, we have a high risk of the PIH. If we are using the CO2, it's slightly less sensitive to water. Of course, it can penetrate deeper because it's less sensitive. So it can penetrate deeper, but still cannot penetrate into the basal membranes, except you are using a very high powers. But again, the higher the energy, the more the heat that we introduce to our skin, the more risk of PIH. That's why lately I use the thulium, sometimes the erbium glass, because it's less sensitive to the water, so the laser can penetrate deeper into the basal membrane sometimes. With slightly modifications to our patient's skin, I can make the thulium laser penetrate shallower or deeper. So I can use thulium laser to penetrate shallower into the epidermal membranes only, or I can manipulate the thulium so it can penetrate deeper into the dermis layer. So that's why I love to use the thulium. So basically, using the thulium, we can target the basal membrane by itself, by naturally. So why I can say it's a very, very unique device is because it's also open the pulse duration. Like we know, if we are playing with lasers, we always playing with two things. We are playing the photomechanical ablations, which means we are creating the photomechanical destruction, just like when we are using the PICOs, there is a LIOP, laser-induced optical breakdown. Basically, we are create a small vacuole, we are creating a small destruction in our cell. That's the photomechanicals. And the second way, we create the photothermal stimulation. Basically, we are try to create less ablation, we are trying to create less damage into our cells, but we are trying to create the bulk heating, bulk stimulations. It's slightly different with compared than the oligeo using the monopolar RF. The oligeo basically try to stimulate the heat, try to create a bulk heating on the deeper layers. So most likely on the deep dermis. But using the thulium lasers, I can stimulate the thermals from the superficial, which is from the epidermal, to the basal membrane and slightly the papillary dermis. So it's basically, it's complementing each other with the oligeo. But using the thulium, since the pulse duration is not being locked, it's open up, so we can modify it as your preference. So we can create a very short pulse or the very long pulse. We can create a total photomechanical ablations, or we can create a total photostimulations just by the pulse duration by itself. So basically, for me, the best laser that we can adjust the depth, we can target it to superficial layer, we can target it to deeper layers. How I do manipulate it? By creating, for example, if I want to create a shallower penetration using the thulium lasers, just before the lasers, mostly I do inject it with the skin boosters. I try to hydrate the superficial layers of our skins. I try to inject, you can use HA, you can use just natrium chloride just to infuse the waters on your skin. So the thulium laser is going to penetrate shallower because it's sensitive to the water. But if you want to create a deeper penetration, mostly I'm going to use the cooling devices, because when I introduce the cooling devices into your skin, the level of evaporating water on your skin is going to increase, so your skin is getting slightly drier. That's why the lasers can penetrate slightly deeper. So for me, the best lasers that we can adjust how depth the penetration of the level is. Second one is I can choose the interaction of our lasers into our skin between the photostimulation and the photomechanical ablations. That's, for me, it's going to create the best way of using the energy-based devices. And for another benefit, why people only know 1927 as the transepidermal drug delivery. Why? Because when we penetrate the lasers, the thulium laser into our skin, because it's slightly less sensitive to the water, so the pathway of the laser just create a slightly ablation into our skins. And then in the basal membrane, which is where our water is mostly, that's going to create the most ablation in our skin. So basically, it's going to create like a teardrop shape. So from the first pathway, it's going to create a slightly ablation, and the end of the pathway, it's going to create the ablations if we use it just by normally. So in our skin, we normally know there is a rule of 500 Dalton. So basically, if our keratin is fully healthy, if we apply the drugs topically, the drugs that above 500 Dalton, the size is above 500 Daltons, it cannot penetrate into our skins. That's the rule of 500. So since we are creating a slightly ablation, the pathway of ablation into our skin, so the rule of 500 is no longer applied into our skin, so our drug can penetrate deeper. So based on the research panel article, using the micropen, it's already increasing the level of transepidermal drug delivery if we apply topically first and using the micropen. But when we are using lasers, why lasers create better penetrations for the transepidermal drug delivery? Because of the coagulation zone. So the bigger the coagulations, the bigger the penetrations of the transepidermal drug delivery. And if we are using the erbium lasers, because it's very sensitive to water, it's very safe to the pH prone, that's why we are creating less coagulating zone. If we are using the CO2 lasers, of course, we are creating a huge coagulation zones, but we are also creating the carbonization area, where the carbonization area, it's inhibit the transepidermal drug delivery. Using the thulium lasers, we can adjust how big the coagulation zone is, for example, like this, how deep the coagulation zone is without the carbonizations. Because when we are using the CO2, we are burn our cell, we are destructing our cell with the temperature is more than 70 degrees Celsius. It's already creating the carbonization zone. But with the thulium, because it's less sensitive, we are increasing the heat just slide by slide. It's just adjusting by length slightly. So we are not creating the heat, increasing the heat like a spike like the CO2. That's why we are not creating the carbonization zone. But we are just trying to creating the coagulation zone. The higher the pulse duration is, the deeper and the wider the coagulation. So just for example, like, okay, I don't want to give a downtime to my patients. I just want to create a big coagulation zone. I just try to introduce the transepidermal drug delivery. I'm going to lowering the power for the thulium lasers, but I'm going to increasing the pulse duration of these lasers. So I'm creating the small ablations, just the pathway for the transepidermal drug delivery, but creating the huge coagulation zone. So to make sure my drugs can penetrate deeper. So how does it work? For example, like the hair. Because we are targeting the superficially and the mid-dermal layers, and the thulium chromophore is water, so it's not affecting the hair follicle. For example, like when we are using the long pulse NDX laser, it's quite hard for us to treat hair regrowth. Because the NDX gonna target the melanin, the pigment which is on the hair bulb. Using the thulium lasers is affecting the water, so it won't affecting with the hair bulb, but we are creating the microthermal zone. When we are creating the microthermal zone, we are inducing our body, we are trying to create the VEGF, FGF, PDGF, and IGF-1, which is going to stimulate our bulb stem cell. So it's going to trigger the new hair regrowth. And it's going to push our hair cycles into anagen phase. So it stimulates, it's make our head grow faster compared than the before. And the most important thing is, normally we always give topicals for our patient. For example, like minoxidils, peptides, exosome, or any growth factors. Our keratin in our scalp is quite thick. That's why the topical product is quite hard to penetrate into hair follicles. Using the thulium laser, I can help the product to penetrate deeper. So that's why this product is quite good for the hair treatment. So basically, the resume for the hair treatment is going to be like this. We are create the microepidermal damage to create the stimulation to increase the fibroblast growth factor. And when we are increasing the fibroblast growth factor, we are increasing the skin thickness of our hair follicles. So when the thickness of the hair, our scalp is getting thicker, it can hold our hair follicle tighter. So it's reducing the hair loss. And it's going to trigger the new stem cell from our hair follicles. So basically, I'm going to use thulium laser every 3 to 4 weeks, always combining with the topical products. And how about for the brightening? For the brightening, the thulium laser is going to work in 2 ways. First way, because it's going to create a slightly ablations into our cells. So of course, the melanocyte that's already been delivered to our epidermal layer is going to ablate by itself. And the second one is because the thulium lasers work on the basal membrane where our melanocyte location is. So basically, if I do shoot the thulium lasers on the basal membrane, I remove the melanocytes. So if I remove the melanocyte, I do strengthening our basal membrane. So just like the needle RF, why needle RF can help with the pigmentation? Because needle RF can help to regulate our basal membranes. So basically, it's almost the same. We tried the micro ablation zone using the thulium, try to promote the regeneration to our basal membrane to create a strengthening basal membrane, try to regulate the basal membrane, and try to remove the overproduced melanocyte. So basically, if we do combine it, the thulium laser with another energy-based devices, it's quite safe because we are trying to reduce the number of melanocytes being produced. So we are lowering the risk of the PIH. So we can do the combination using thulium or PCOS or thulium by itself, we can. So I don't have any problem using the thulium laser for any skin type, especially in Jakarta because we have a skin type 4, 5, and 6. So basically, why the basal membrane? Because the stem cell location is that melanocyte locations. Also, the basal membrane disruption, the reason why pigment drop into our dermis layer. That's why it's creating a thermal pigmentations. And can we do as a fractional and skin tightening as well? Sure, we can, because we can lowering the pulse duration to create a slight mic fractionals, or we can increase the pulse duration, just try to create the bulk heating. When we are trying to create the heat shock protein for the immediate tightenings, so we are strengthening our collagen. We are shrinkage our collagen, so we are increasing the strength of our skin. So basically, it can use for the collagen remodelings as well. So this is the before and afters. After this is basically just the before and after. This is just for the hair treatments for 4 to 5 months. And this is also for the hair treatment to 4 to 5 months. Normally, the distance between each treatment is 1 month apart. 1 month until 2 months apart. So it worked perfectly fine. But normally for the hair treatment, I always combine it with the topicals products. This one for the pigmentations. The thulium by itself also create a brightened skin tone. It helps to remove the pigmentation on the epidermal layer, also on the dermal layers. So basically, on every part, the pigmentation is getting better. So this one for the pigmentation, pores, and the skin's textures. Just by 2 times of treatment, so the before and after distance is only 3 months. So this one, of course, the skin tone is getting better, but mostly I do treat it for the scars and the pores. After the treatment, we can clearly see the improvement on the pores and the scars as well. This one, before, immediate after, what do patients expect after the treatment? Just slightly erythems. The slightly erythems normally gonna go away in 1 day only, because what? We create just small ablations into our skin surface. That's why normally you can have the inflammation just only for 1 day, just slightly inflammation, and then it's completely gone in the second day. This is just after one treatment for the skin textures and the skin surface. But how for mixed pigmentations, epidermal and dermal pigmentation? This is after 3 times of lasers, you just use thulium by itself. It can help with the epidermal and dermal pigmentation this time as well. And I can use it also for the hyperpigmentation and also achronosis, because the use of hydroquinone in Indonesia is uncontrollable. So that's why there's a lot of cases of achronosis and the hyperpigmentation after the PCOS, because mostly Indonesian doctors think if we have an achronosis, normally we can use very high power of pico. That's why it's going to create a problem like this. Normally for the problem like this, I always combine it thulium with the pico lasers as well. But for the pico lasers, normally I only use a very small power for it. This is for the scars and the pigmentations as well. This is normally after one-time treatment, and this is for the skin tightening and the scars. So basically, I can use thulium lasers for almost all of the case in my clinic, except that we are targeting the red chromophore or the hemoglobin, the oxyhemoglobin chromophore. We have to use another kind of lasers. Thank you.
Thank you, Dr. Almond, for the wonderful presentation. And we would like to invite Dr. Dongda and Dr. Anna on the stage again. We will do the panel discussion. And we have a lucky draw for all of the audience today. The giveaway is remover limited edition in orange colors. If you take a photo of me or of our speakers, any pictures, and share your impressive in our lectures today, and share and tag WONTECH Thailand on Instagram, and we will announce the lucky person on 4 p.m. on online, and you should get back to the booth and pick up your lucky draw. Luckily, it may be me. For the panel discussion, I would like to ask Dr. Dong Dao first. In terms of safety, what is the main concern when you treat a patient?
As I have told before, the important thing you should notice about the endpoint. Because of the key of the monopolar F is the target temperature. So you should reach to the optimum, but not excess over the target temperature.
I think when we do the treatment, we have to rising the energy, right?
Yes.
But how to rising the energy is up to individual, up to the patient, up to the doctors who very get used to the technique, right?
Yes, but the same target.
The same target is
Yes.
the rising the energy
Yes.
to bulk heating.
Yes. You can drive anyway to the target.
And if you compare the patient who have the saggy face or the chubby face, which patient who you think that is suitable for Origio X?
Because of they have to dual mode. So I can customize. We can customize in any case. But you should localize which layer that you want to target.
Yes.
So I think it can treat all type of the patient. Yes, by adjust which mode you use. If you want to deeper, you use a more X mode. And if you want to superficial treating, you use a G mode.
Because we know that they are the gradients of the energy, right? If you cooling the skin enough, the RF will go deeper, and we can uh, waiting for the accumulate heat, and the RF energy will go deeper by the retinacular cutis, and the fibrosepta is can go deeper with that tissue too. For Dr. Anna, in terms of the Oligio X mode, what is your favorite indication for the lower? You like the lower face, right? And how can you adjust the energy or the mode that you use?
For the lower face, right?
Yes.
Actually, the advantage of Oligio X is have two modes, G and X mode, and we know that G mode provide more superficial heating, so it will affect in skin tightening and skin quality improvement, while X mode can penetrate the deeper tissue layers, so it can reduce the fat more effectively. And so actually it's the advantage because we can adjust and we can individualized treatment planning for the patient need. So in the chubby face, I recommend to use the X mode. But for the sometimes that have skin laxity, I prefer to use G mode. Yes, because G mode will help in skin tightening.
For the high BMI patient, right? What is your favorite way to increase the shot or increase the energy?
Actually, for the high BMI patient, the first thing I will do is setting realistic expectation because high BMI patient, we know that they will come with excess fat, skin laxity, and increase in tissue weight. So my goal is not dramatic fat reduction in one session, but I prefer to create an overall lifting and contouring effect. So I will expand my treatment area. Beyond the submental area, I will do in the cheek, in the jawline, in the upper neck to create overall harmony effect. And I tend to use both G and X mode. But I will use X mode first to target the deeper tissue to reduce the fat effectively and then finish with the G mode. For superficial heating, for skin tightening and skin quality improvement. And for the level energy adjustment, I will adjust by tissue thickness and patient tolerance because everyone is different. And for the shot, I will start from maybe 200 to 300 shot. But actually in real world practice, there are many factors involved, include tissue characteristic, tissue thickness, and the patient budget. So maybe it's different from any patient, but I prefer to use the X and follow up with the G. Yes.
Me too. Because I think when we use the X mode first, we can go deeper. And we use the G mode to longer lasting. Do you have any
No,
comments?
because I also have the Oligio, the normal Oligio, also the Oligio
Okay.
X as well. But for me, the Oligio X is the best area is for the under eye, just to be honest, because for the submental area, sometimes the expectation of the patient is too high sometimes. So sometimes it's quite hard to please our patients. But normally for the under eye, normally it's quite obvious because normally the patient can see the under eye every day. And why I do like the X very much for the under eye because, you know, many plastic surgeons now try to preserve the under eye fat pad. They are not trying to remove our under eye fat pad anymore, but we are trying to create a strengthening the muscles. So they are repositioning our muscle, they are repositioning our fascia. So when we are using the Oligio X for the under eye, using the under eye tip because it's so small, so we are try to enhance that. We are try to stimulate our retinacular cutis, our under eye, and basically it's strengthening our orbicularis oculi fascia. So it's improved by a lot for the eye bag, especially for not for the fine line for the under eye, but for the eye bag. So it's only need a 50 shots for each eye, so the treatment is so fast, it's 10 minutes and done without any numbing creams or anything else. We just need to do it twice. In the gap, the difference is for me 4 months to 6 months, the gap difference, but the result is really nice.
Do you have any comment about the eye because you are ophthalmologist?
I do the same with the eyes because I believe that the septum, the orbital septum, I think that the heat will reach the tissue, yes, for tightening for the eye bags. I always do like to do not preserve any fat.
For the Dr. Almond, that your presentation about the thulium laser, what is your favorite indication for thulium laser?
Okay, for me, thulium laser, the best indication is the hardest things, which is mostly the PIH after any other treatments. And second one is big ochronosis, like I said. In Indonesia, the hydroquinone is out of control because so many online shops try to sell the hydroquinone without any
The same
prescriptions.
in Thailand too.
So we do have a lot of problem with it. And so many pharmacists or supplier for the energy-based devices always telling, oh, it's better using the pico lasers, using a very high energy, try to disrupt all of the pigmentations. And then that's why sometimes you can create a hypopigmentation on some area, some hyperpigmentation mixed with the ochronosis, and it's create a harder job for us. So that's why I'm trying to limit the number of melanocytes in our patient's skin. That's why I use the thulium laser, try to regulate the basal membrane, try to regulate the number of the melanocyte first. And then I do combine it with the lasers, sometimes using the pico lasers, but the very low power. So basically, thulium laser for me is like a fixing tools when all the energy-based devices fail to do its job.
And for the drug delivery, which drug that you applied mostly after thulium laser?
Mostly, for hair and face, mostly I use the exosomes, to be honest, because the problem with all of energy-based device is always the inflammations. That's gonna be always the problems. For the hairs, if we prolong the inflammation, it's gonna create the chronic inflammation, so our hair follicle is gonna be destroyed by our own cell as well. That's why I always use topicals, exosome, secretome just after the thuliums. Even though for the face as well, because the skin type is 4, 5 to 6, so I'm also slightly afraid to create the hyperpigmentations. I try to limit the number of inflammation in our patient's skin. That's why I always combine it with the exosomes and secretome. But mostly, I try to limit the combination with the polynucleotide because of the pain sensations. After the thulium, it's slightly itchy. Our skin is become more drier. So if you do inject it with PN, it helps with the anti-inflammation as well. But the pain sensation, the patient won't like it.
Yes. I used to inject myself with PN, but after half phase, I asking myself, but what am you doing now? It's too painful.
That's why I won't combine it with PN.
Yes, but I already done thulium laser on my face, and I think the good thing from the thulium laser is it's not too painful when we do the treatments. If you compare to fractional CO2 laser, it's very burning sensation when we do the laser, and for the downtime is less than other uh, other full ablate. Fractional laser. We have 15 minutes left. Don't forget to take our pictures. And if you have some question, you can ask. The microphone is over there. Anything on the floor. And if someone asks the question, the company will give you some souvenir.
And our oleo tips, the eye tips, mostly for the under eye, but it's quite hard for us to apply it for the upper eyelids. That's why I use the thulium laser as well for the upper eyelids. Because when we are using the oleo for the upper eyelid, it's quite hard to give a pressure because there is an eyeball.
Uh-huh.
So that's why normally only half of the upper eyelid we can treat it using the oligeo because we have the orbital rims on it. But for the rest of the upper eyelid, we cannot do using the oligeo because of the gels. We are afraid the gel is going to penetrate into our eye, the pressure as well. That's why normally I use the thuliums.
But you applied the eye shield or not?
Mostly not, just
Just
ask the
fraction.
patient just to close the eyes,
Uh-huh.
and we can do the whole treatment using the thulium. And you know, CO2, erbium, thulium basically is a water. It's the chromophore is the water, so it's quite safe when we are treating the eyes because our cornea is full of water, so it won't create any coagulation or anything else. That's why it's quite safe for us to treat the upper eyelid, except the patient is just open up the eye and we are doing the laser while the patient open up the eye. Yeah, of course, it's gonna be silly.
And for Dr. Dong Dao, if you can uh, adjust the parameter that uh, you will use the highest energy first, or you use the smaller energy and rising up, which is your way.
In my way, I use the highest before, and I noticed that what happened on the skin by touching, seeing, and if I know that it more the color is changed more to more erythema, so I adjust down, lower the level. Yes.
Mostly for full face, how much the shot that you use? It's up to the shot or it's up to the accumulate energy?
It depends on the patient problem, but I've started with 600 shots. But now we use more, and now is 900. Yes.
For the total face
Yes,
with upper
yes,
face,
yes.
combined with upper face.
Total face and submental and the neck.
For the off face area, for the Oligio X, which area that you satisfy the result?
Actually, in the jawline.
Uh-huh.
Yes, because nowadays patient come and patient want to look more lifting, tightening, and look skin firmness. So, the Oligio S is suit for the jawline. It will help in a little bit lifting and tighten the skin. Yes.
What about another area?
Another area I do is the neck.
Neck.
Neck
Okay.
area. Yes.
And you do the posterior neck,
No.
only the anterior side?
Yes, only the anterior side.
Because there are some speaker that they present do the Oligio X at the posterior neck. They also have the effect of the lifting also. Any question from the floor? We have another ophthalmologist.
In your opinion, what do you think about GLP-1 and Oligio X?
Which one you want to ask? Which one?
Everyone. Thank you.
Okay, this is just this morning. Or last night, I just discussed it with Ms. Rachel, which she's our distributors for Oligio X in Indonesia. So in Indonesia, the GLP-1 is also quite popular. I think in
Same
Thailand as well,
Yes.
because every female want to look slim. So for me, I'm liking more the G modes for the Ozempic phase or the GLP-1 phase.
Yeah.
Because we try to preserve the subcutaneous fats, to be honest. Because the GLP-1 problem mostly because we lose the subcutaneous fat layer too quickly, so our skin is not attaching well into our fat layers. So it's create some hollowness. The skin lose its elasticity. The skin lose the water reservoir and everything else. So when I do try using the X mode, and it doesn't give any significant results for it, to be honest. So I'm just sticking with the G mode for the patient when the patient using the GLP-1, and I'm not using a very high powers, because if I'm using the very high powers, I'm increasing the heat too fast, the heat is always going to penetrate into our deep dermis layers. It's always. So better for me to increasing the power just slide by slide. Normally, I'm going to start from 3. It's even though some doctors said, oh, it's too low. But for me, it's still much more safer. And then try to lock the heat only on 45 to 50 degrees Celsius, not beyond that, because based on my experience, if I lock the heat more than 55 degrees Celsius, the heat always going to penetrate again into our subdermal layers. So I'm just trying to create the bulk heating on the skin levels, that's all, and using only the G mode without the X mode. That's based on my opinion and my professional experience.
You combine with other modalities?
Of course, of course. Normally, I won't use the collagen stimulators products. Normally, I won't use it immediately because
In the same day?
either in the same day, because when we are using the GLP-1, basically the environment for everything in our subdermal layer is not in a good conditions. That's why normally I'm trying to fix all of the environment on the subdermal layer first. Normally I'm using just pure high molecular weight HA, or sometimes I'm using the polynucleotide, not injected intradermally, but I'm using a cannula on the subdermal layer, try to float the area using high molecular weight HA or PN. Do the repetition twice mostly, and then the third treatment, normally I'm gonna using the energy-based devices. That's going to be always become my protocol in my clinics.
I have a case that they lose 16 kilograms after they inject the GLP-1. And they come to my clinic and done Oleo X, done KAHA, 3 syring of KAHA, done PN 2 times. And they changed the skincare. But he told me that, oh, get better from skincare.
He is your close friend, I guess.
Dr. Dong Dao.
In my opinion, I never faced the problem from the weight reduction. But when the patient come to my clinic, I saw her that they have a more BMI. So I advise them to use GLP-1.
Combination,
yes,
right?
combination with my treatment. Because I think that we can predict what will happen after. Yes, but I don't face patient.
You don't want just only waiting for the machine works, but
Yeah,
you want
yes.
to reduce some
Yes,
superficial
the
fat
same
too.
along with. Yes.
I see. Fun.
Actually, I think it depends on the patient problem. So if the patient have the more chubby skin or more fat, I will recommend the X mode. And if the patient is sagging and want to improve the skin quality, so I recommend the G mode. And in the GLP-1, maybe GLP-1 user, maybe they will face with a sagging face more than the chubby face. So I recommend to use G mode as Dr. Almond told, yes. And maybe combining treatment, maybe recommend to enhance the more better outcome.
Dr. Arm will get some souvenir from the OneTech booth, but not Remova because Remova is mine. Any question more from the floor? Okay. So in the name of OneTech Thailand, I would like to thank you, Dr. Dong Dao, Dong Nam Sawang, Dr. Shalini Piantanapak, and Dr. Almond Wibowo from Indonesia.
Thank you.
Thank you. And thank you OneTech Asia Thailand to organize fruitful events today. And if you have some question about the machine or about the protocol, please contact the company booth. And tonight we have the Wave Bangkok events, and we will talk about some machine more from OneTech Asia, maybe Pico Majesty, this 1064 nanometer and 532 nanometer Pico laser, and we talk about the 755 nanometers Pico Alex, and about the Titan, about the Origio X. Please feel free to ask for some spot left at the booth and see you tonight. Thank you.